Good morning. Thank you so much for joining us today. There are a variety of attendees who have joined us, from staff and board members, from local United Ways across our state, elected officials and their staffers, nonprofit partners, and active and engaged community members. Welcome everyone. We are thrilled to have you here for the South Carolina release of the 2025 State of Alice in South Carolina report. I'm Paige Stevenson, President and CEO of United Way of the Piedmont, serving Spartanburg, Cherokee, and Union counties. And I'll be your host this morning, along with my fellow United Way colleagues from across the state, as we discuss the State of Alice in South Carolina. We appreciate you all joining us today to hear more about the critical new report from our partners at United for Alice and the United Way of Northern New Jersey. Make sure to place your questions in the chat as we go along. Staff will be monitoring and responding to questions throughout today's webinar. Also include your email address with your question so that if we are unable to answer that question today, a staff member will be able to follow up with you directly. We will also send a recording of the webinar and a digital copy of the full report later today, as well as a link to the updated United for Alice South Carolina website. In South Carolina, United Ways from across the state work together to utilize Alice data in our communities. Let's welcome my colleague DJ Hampton, President and CEO of Trident United Way, who will share a bit more about our statewide partnership in this effort.
Thank you, Paige, and welcome everyone. As Paige said, my name is DJ Hampton, President and CEO of Trident United Way. We're based here in North Charleston and serve the Tri-County area of Berkeley, Charleston, and Dorchester counties. We appreciate you all joining us today to hear more about this critical new report from United for Alice. 2 years ago, United Ways across South Carolina joined forces through the United for Alice initiative to better understand and address the challenges faced by Alice. Alice stands for Asset Limited, Income Constrained Employed. These households are working families who struggle to afford basic necessities despite being employed. This statewide partnership has been vital in building a unified voice and coordinated action to mobilize resources while developing solutions that are responsive to the real needs of Alice families across our state. By collaborating across the state, South Carolina United Ways are able to share data, amplify impact, and ensure that services and supports are effectively aligned across our regions. Together, we are building a stronger, more resilient safety net for the thousands of South Carolina households that are just one emergency away from financial crisis. And now, it is my pleasure to introduce you to the statewide United for Alice team. Black River United Way, United Way of Aiken County, United Way of Anderson County, United Way of Allendale, Barnwell, and Bamberg counties, United Way of Florence County, United Way of Greenville County, United Way of Horry County, United Way of the Lakelands, United Way of Lancaster County, United Way of the Low Country, United Way of Oconee County, United Way of the Piedmont, United Way of Pickens County, United Way of Sumter, Clarendon, and Lee counties, United Way of York County, and Trident United Way.
South Carolina is United for Alice.
Thank you, team, and thank you, DJ. For those of you who are new to this work, ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed, and it represents individuals and families in our communities who are working hard, yet they are still struggling to afford the cost of basic necessities. The ALICE framework is a data set, body of research, and one of the lenses that we can use to determine areas of need within our local communities. We believe this data is more comprehensive and precise than the outdated federal poverty level, and therefore more applicable as a means of determining need in any given community. ALICE is also a term used to describe populations in need of financial support in order to afford those basic necessities like housing, food, utilities, and childcare. We are so grateful to each of our colleagues for their dedication and shared efforts in this critical work. As part of this statewide partnership, we come together every other month to share ideas, successes, pain points, and collaborate in any way that we possibly can. Felicia Cuthbertson, United Way of Allendale, Barnwell, and Bamberg County's CEO, is one of our key partners in this statewide work. I'm pleased to introduce Felicia, who will share how her United Way has leveraged the United for Alice initiative to amplify their community service programs.
I learned about Alice more in detail earlier this year when we were offered a partnership through our state association to be an Alice partner within South Carolina. And so in participating in the meetings and doing research, Alice was really a solution, like another criteria that we needed within our community. The counties of Allendale, Barnwell, and Bamberg are often known for our statistics, being higher unemployment, the resources we don't have. And so Alice data became like a solution to so many things we already knew existed within our community, but it made it tangible data to use. So after we received our Atlas data, we knew within our community that were many areas that we could tap into that data. But when we utilized the One SC Fund, that was kind of our starting point, and it made a world of difference in the impact in reviewing eligibility, and just being able to simply go to a chart, put in what that household's composition was, and determine that they qualified or they didn't. Very simple process, and looking forward to. I can't say that I want to take over the social service component of our area, but I think that this is a newfound access to what more we need to do to make sure we are caring for all those who may qualify. So our community has embraced it. In one of our presentations with the local mayor, it's kind of, I wouldn't say an old wives' tale. We've always known in our community that our working community members, those that work at our local retail and fast food, so those things that make our very small towns thrive, that there was a missing factor, that although they were working and contributing citizens, that there were things needed to supplement what they needed to survive. And so the Alice data put numbers, and it made it tangible by looking at those different criteria to understand it. So it's been well embraced. Specifically at our United Way, when we had supplemental housing funds to try to assist as we went to different employers, there was somewhat of a not feeling disrespected, but a misunderstanding that their employees could qualify or may be in need of assistance because they felt they compensated them at a quality wage. Well, this data makes it tangible to say not so much that as an employer you're missing a mark, but the cost of living and many other factors depending on your employee's household size may warrant them needing supplemental assistance. And so it has been really embraced. It may be one of the favorite things that I brought to our community partners. Again, because it's an answer to what we've known. It is where you can go and find numbers to validate what you know in your heart and in your mind from having experience in the social service field. We were able to include the ALICE criteria for eligibility as a part of our grant application. And when we were funded, it was kind of the first time that ALICE eligibility was put into place within our community. And so our partners got to experience that there would be a new understanding of who could apply for those funds, but it also opened an access. One specific story is we had a community member that was on a prepaid utility service, and generally through other partners it's difficult to assist those because those accounts are not past due. But based upon the Alice household size data, we were able to determine an adequate amount that could be applied to that individual's account. And so it was an answer to what was a temporary program for us, but now a new solution for our partners that do that every day. And so it was definitely enlightening. It was exciting for all the families with health, but for that one applicant, it really meant like a new day for the community members that have to have prepaid utility accounts. And for the specific 1SC Fund program, it was a sense of relief. A lot of the individuals that we helped with their electricity bill, it was they paid what they could towards it, but that balance steadily increased. And so especially considering the hurricane's impact, if there were lost wages or additional items that had to be addressed, for them it was a sense of relief that now there is something that applies to me. And so it wasn't even, and I guess there was a relief that, hey, somebody understands, but not really any personal stories of they were happy to have peers. It was just that they were glad to have somebody that acknowledged, like, hey, it is hard where I am financially also. And I can say without being on a board of any of our other partners, those that do utilities, when they figured out that there was a way to assist a household with prepaid utility accounts, it was very embraced, especially for those customer service or those application processing employees that deal and see kind of the heartache and the need in that area. They were really excited to have a resource, and then even our town councils have embraced, because again, I think they want the best for every resident in their community. And so when you get the data side of it, it helps to know, hey, we need to adjust this, or we need to look and understand that there are more opportunities to serve our working class community members as well.
Thank you so much, Felicia. I really appreciate hearing more about your work and look forward to seeing the impact of these particular projects. Thank you so much for all you do. Now we'll move into sharing the 2025 ALICE report, the State of ALICE in South Carolina. I'm pleased to introduce Katie Reams, Statewide Director of the ALICE Initiative. Katie is based at Trident United Way and is an invaluable colleague to all of our local United Ways across South Carolina. Katie will be diving into some of the findings of this report and sharing some key statistics. Hey Katie, welcome.
Thank you, Paige, and thank you to everyone joining us across the state this morning. We're so grateful to everyone's support for our ALICE work and the statewide ALICE initiative. Over the next few minutes, we're going to take some time and review the information and the ALICE data in the State of ALICE report to understand more about households and what they're experiencing in financial stability in South Carolina. So ALICE stands for Asset Limited Income Constrained Employed. And what that means for us is understanding more about households that make more than the federal poverty level, but not enough to make ends meet from month to month, meaning some kind of income is coming into the household. Maybe that's income from a job or multiple jobs. Lots of households work more than one job. Individuals are working more than one job. Or there's other streams of income. Maybe some folks are retired or on disability, have Social Security coming into the household, but some form of income is coming into that household. And it means that that income pops them above the federal poverty level, but those households still aren't making enough to make ends meet from month to month. And what that means for those families is they often aren't able to make things work. They have to make decisions between whether they can pay utility bills, pay rent, pay for medical emergencies. What happens when hours are cut at work? What happens when they have to stay home with a sick kid? And so what we're going to do is walk through what that looks like for individuals and looks like for their households. So the ALICE measures were developed by the United for ALICE team at the United Way of Northern New Jersey several years ago. And it answers that pressing need for a more accurate picture of financial hardship. And the federal poverty level does not consider the wide variety of cost of living by location or geography. And it also does not consider the variation for household composition. And what we mean by household composition is who's living in your household. Are there kiddos in your household? Are individuals over the age of 65? Is it a bunch of college kids living in 5 Points trying to make it work? And we know that that matters, right? We know that that matters because based on who lives in your household, things may cost less or more. You may be spending more on things like health care or food cost or transportation cost. And so we know that oftentimes the federal poverty level is used for defining things like eligibility for many types of things like public assistance or nonprofit services. And ALICE households simply don't often qualify for those things. So the ALICE model helps us have a better understanding and a better model for understanding what folks need to survive. When we're discussing both households that are living below the federal poverty level and ALICE households, we're talking about households that are considered below the ALICE threshold. And that again includes both households below the federal poverty level and ALICE households. Put together, we call that the ALICE threshold. And that's really important for us to understand because in the state of South Carolina, local United Ways all across the state are really serving all of those households. That's the work we've always been about, and it's the work we'll always continue to be about. Households that continue to be unable to afford the basics. Households below the ALICE threshold are in every county and every city across South Carolina, spanning all demographic groups and impacting every community. And in South Carolina, that makes up 42% of households. And 42% of households in South Carolina fell below the ALICE threshold in 2023. And in 2023, of South Carolina's nearly 2.2 million households, 14% were below the federal poverty level, and another 28% were ALICE households. So again, when we combine those two, we know that's the ALICE threshold. And so we know that those folks combined make up 42% of households. And that's an incredibly staggering number. Combining those two groups is really important for us to understand what a true picture of financial instability looks like in South Carolina. The ALICE model uses data from federal and state recognized data sources such as the Census, the USDA, and DSS to help determine what income is needed in households to survive. And when we break that out into a bunch of different categories, as you can see on the screen, this is called our household survival budget. It kind of breaks it out into different buckets, and you can see that here for transportation and technology and things like childcare. Now we recognize that not every one of these categories do households spend money in particular childcare. So for some households that childcare category is zero, but for every other category we know that households are spending some form of money within that category on a month-to-month basis just to survive, just to make it from month to month. We also recognize that this is a very conservative budget, and what we mean by that is that it doesn't really account for a lot of extras. This is not any type of money to eat out. This is not any money for birthdays or Christmas or summer camps. This does not include student loans, and this does not include any type of car loan. This is really just the basics. This is paying your basic bills like rent and utilities, paying for gas money, paying health insurance, and then basically just rinse and repeat and do it again the next month, right? Just surviving and for folks to move on to the next month. And it certainly doesn't include things like savings. And so we recognize that this really doesn't prepare folks for any form of real true financial stability. And so when emergencies happen, particularly ALICE households and households falling below that ALICE threshold are really at risk. In South Carolina in 2023, the ALICE household survival budget was $30,000 for a single adult and $74,000 for a family of four with two adults, an infant and a preschooler, which is much higher than the federal poverty level. The federal poverty level is about $14,000 for an individual and about $30,000 for a family of four. And we know that this gap leaves many households unable to afford the basics, forced to make super tough decisions, between paying utility bills or getting a car fixed, paying rent, or receiving the medical care needed. And we know that many of us on this webinar have been ALICE. We currently are ALICE. We had been or personally know an ALICE household. And households that continue to work multiple jobs just to make ends meet and really just never seem to get ahead. And between 2010 and 2023, the total number of households in South Carolina increased by 23%. The number of households in poverty increased by 4%, and the number of Alice households increased by 36%. So we know that our work as the United Ways of South Carolina continues, because so does the need of the communities that we serve. So as we revisit the Alice household survival budget costs for a South Carolina family with 2 adults, meaning for 2 adults and an infant and a preschooler, so thinking kind of that family of 4 with 2 children in childcare, we have that total of about $74,000 annually needed just to survive. As a reminder, that doesn't include things like savings or summer camps or Christmas or anything like that. Those are just those basic needs, month to month, paying those basic bills. And we know that based on that data, those full-time wages of many of those folks, of the most common wages in South Carolina, simply don't add up, and to that amount for many households. And what that means is it leaves many of those households unable to save money, unable to pay for emergencies, and ultimately unable to become financially stable. They just can't weather the storms, both literally and figuratively. They just can't make it through. A broken down car can lead to being unable to fix it, can lead to job loss, can lead to eviction. Right? And so we recognize we want to be able to help families make those next steps and provide those supportive services. Workers below the Alice threshold often perform the jobs that keep our communities going. Most commonly, those occupations with workers in households below the Alice threshold include occupations like cooks, about 56%, cashiers, 54%, personal care aides, 52%, and stock workers at 47%. And so we recognize that these are really crucial, important jobs that help our communities grow and continue to function on a day-to-day basis. We also recognize that folks that are working full-time in these positions are, at the majority, unable to make it work from month to month, even though they're working full-time to make it happen for their families on a day-to-day basis. Though the majority of adults in South Carolina in 2023 were working, and most households had at least one worker, only 21% of the population aged 16 and over had the security of a full-time job and a salary. And so what we know about that is a full-time job and a salary means really crucial, important things like benefits, things like PTO, things like health insurance, things like flexible spending accounts or retirement, things that help families be able to take crucial steps towards financial stability, being able to have access to medical care, access to time off where you can attend those doctor's appointments, the ability to take time off and attend crucial things like parent-teacher conferences or be engaged in your child's education and be an active parent in the school system. And so what we recognize is that workers who are paid by the hour are more likely to have fluctuations in income due to schedule changes and variable hours, and they are less likely to receive benefits such as health insurance, paid time off, family leave, or retirement plans. And we know that those are all really key factors that contribute to financial stability within a household. And so we want to help our Alice families have access to those things in the labor force. Nearly 2/3 of our labor force in 2023 in South Carolina were hourly or worked part-time. Additionally, the age group with the most substantial increase in the number of households below the Alice threshold is the households headed by those aged 65 and up. That specific group of individuals saw an increase of over 60% between the years of 2010 to 2023, reaching 51% of all households aged 65 and up total. in 2023. This age group has found the continued increase of cost of living particularly challenging due to their fixed incomes. It's often difficult to increase the income of households headed by someone age 65 and up, and nonprofits often work to supplement their income with resources like food pantries and prescription assistance programs. As we have all noticed over the past few years, housing costs have continued to be a challenge, especially for households below the ALIS threshold. In 2023, 27% of all renter households below the threshold in South Carolina paid 30% to 49% of their income on housing. An additional 39% paid half of their income or more. Combined, 66% of all renter households below the threshold in South Carolina were rent burdened, paying 30% or more of their income on rent and utilities. Similar to the rate in 2021, which was 65%, for homeowners below the threshold, 43% were housing burdened, paying 30% or more of their income on homeowner cost, including mortgage payments, utilities, and homeowners insurance. And so what we know about this is that overwhelmingly, housing costs are preventing households, and especially ALIS households, from becoming financially stable. Increasingly, they are spending more and more of their overall income on housing costs. The recommended amount to spend is about 30% of your income, and we can see that ALIS households and those falling below the ALIS threshold spend more and more of the percentage of their income on housing costs. And we recognize that that is preventing them from doing things like being able to save, being able to do things like put money in a college savings account, being able to put money away for emergencies and rainy day funds. And we want for folks to be able to do those really crucially important things to make a way for financial stability. When ALIS households can afford the basics, there's a significant positive impact on the individual household, the local community, and South Carolina as a whole. We see improved physical and mental health, reduced stress, increased labor force participation, improved graduation rates, decreased food insecurity, fewer missed days of work and school, decreased need for emergency services, improved access to job opportunities, and improved ability to withstand emergencies. We know that supporting ALIS household is vital to our communities, and we appreciate your time today. If you would like to become more involved, please take the time to complete our follow-up survey that we will email out today. You can also connect with your local United Way office to find out more. We are so grateful that you continue to support the ALIS work. We could not do this work without you. You can reach out to your local United Way office, and you can connect with your local nonprofits, and you can reach out to your local officials. We want you to be engaged in your community. We want you to be engaged in the work. You can do that through donating, through volunteering, and using your voice to support the community that we know that you love to support. We appreciate your time together, and I'm going to throw it back to you, Paige. Thank you.
Thank you, Katie, for providing the background information on the South Carolina ALIS report and for sharing some of those key takeaways for our state. While we all know all too well the many ways in which financial instability impacts families in our state and across the nation, the findings of today's report are still startling. Proactively, we also know that with concrete, well-researched data like the ALIS reports provided by the United Way of Northern New Jersey, we have clear, solid footing to push for impactful change. Working together in a unified direction, we can improve the lives of ALIS households in every part of our state. And to that end, I'm excited to introduce you to Elijah Melendez, Director of Development and Operations at North Charleston Dental Outreach, a clinic providing dental treatment for individuals whose options for care are limited due to financial constraints and the absence of insurance.
North Charleston Dental Outreach provides basic dental care to underinsured patients in the Low Country. We use ALIS as a way of talking about those folks that are making too much to qualify for traditional benefits, but definitely can't afford going to a private practice dentist. It was definitely an aha moment. So it's very loose category to talk about, well, we know some people are trying to make ends meet, but how are they actually gonna qualify for our services versus people that really are in need? And there was always a question around vetting. And so when we learned about the data and the hard work that went into creating a report based around this, it was such a huge help for us as a small organization to say, this is exactly the kind of patient that we've been trying to narrow down for our eligibility, but never had the data and the support to actually round it out and make it a line for us. So our front desk administrative assistants receive a proof of income or a copy of the most recent pay stub or a certified letter from a client navigator that states the household income and the demographics. We then use the United for Alice website and the calculator provided there for us to input that data, and it either says eligible or not eligible. For other nonprofits thinking about adopting Alice standards for eligibility, I would highly recommend that they consider it, because for us, it's been a no-brainer.
Thank you, Elijah, for sharing the work of North Charleston Dental Outreach. It is so inspiring to hear what an immediate and positive impact the Alice data has made for your patients and your community. If you attended last year's Alice Report webinar, you may remember hearing about Trident United Way's Barriers to Employment program. I'm thrilled to share that this program is expanding to other areas of our state, and proud to introduce my colleague, Cameron Campbell, President of United Way of Florence County. She's going to share how they've implemented that program in the Florence community. Welcome, Cameron, and thank you so much for being here.
Barriers to Employment is a program we recently implemented at United Way of Florence County. The idea came during an Alice presentation to our board of directors when we were looking at the data and discussing ways to address Alice's struggles. Based on the Alice data in Florence County, we know that a large portion of households struggle to make ends meet. With financial stability as one of our main pillars of focus, we saw this as an opportunity to make a difference. Through the Barriers to Employment program, we're providing financial assistance to individuals to help gain or sustain employment due to initial or unexpected expenses, with the goal of helping households achieve financial stability. To give an example of a Barriers to Employment case is to really understand the impact of this work on real people's lives. A member of our community, Miss Smith, heard about the program at work. She reached out and set an appointment during her lunch break. When she arrived, she told me her story, and in her words, life had been lifing. She had lost her son to cancer, which took a major toll, all while she was taking care of her disabled husband. Eventually, she knew that she needed to put the pieces back together, so she found a great opportunity with the city of Florence, and she was able to get her husband enrolled in an adult daycare program. She had just started her new job as a senior activity instructor, but her tires were in rough shape, and she was concerned about getting to work safely and reliably. Unfortunately, she wasn't able to afford the expense of new tires as she was waiting on her first full paycheck to come in. Miss Smith brought her license and proof of employment. She answered a few questions, and before her lunch break was over, we had confirmed that we could assist and had set her tire change appointment. She cried tears of joy as she hugged me and breathed a huge sigh of relief. This was a really important opportunity for Miss Smith. Using the Alice Income Status tool, we were able to see how this opportunity would move her household from poverty to above the Alice threshold, which is the best possible outcome of the Barriers to Employment program. I'm proud to be working collaboratively across the state with many other United Ways in this Alice initiative to share ideas and resources to bring about the most positive impact.
Thank you so much, Cameron. The work you do in the community is truly incredible. We really appreciate you sharing and providing us with an opportunity to learn more about your community and ways in which we can support Alice in our own local areas. As we wrap up today, I want to introduce our final speaker, Dr. Ashley Anglin, Director of Research and Strategic Analysis at United for Alice. Dr. Anglin conducts research, writes reports, and supports the development of new Alice tools and collaborations. Her work aims to ensure that all reports and tools are accurate, engaging, and accessible, and that they, most importantly, lead to action that helps Alice households. Dr. Anglin, thank you so much for joining us here in South Carolina today.
Hello, good morning. As you heard, my name is Ashley Anglin. I'm the Director of Research and Strategic Analysis for United for Alice. I work with our team of researchers, writers, editors, designers, and digital and marketing experts to bring the Alice data to our partners across the country. So on behalf of the whole team, thank you for sharing out this latest update. And for me personally, thank you for the opportunity to join the South Carolina State of Alice webinar. So far today, you've heard about the impactful stories, partnerships, and updated data for the state. But now I'd like us to zoom out a bit to talk about the National United for Alice movement. In total, we work directly with 35 states in the District of Columbia, and we're growing with 4 new states joining in 2025 and more in the works for next year. This research started in one county in New Jersey in 2009, so to see it bloom and grow to include partners like many of you here in South Carolina, it really is truly a dream come true for us on the National Alice team. And it is one of the best parts of that work is the connection between the local kind of on the ground work and the national research, so that we can keep the lines of communication and information open in both directions. We can hear what's happening on the ground for Alice and local communities, and also share out the larger trends that we're seeing from a state or a national perspective. We also connect our partners in various means through working groups, webinars, our National Alice Summit, and we work to craft a unified message through our marketing communications materials to really spread the word and spread the word together. And that's really key because bringing attention to Alice is important because despite struggling to afford the basics, Alice households often go unrecognized. Our neighbors, our friends, family members, coworkers, folks working in jobs that keep our communities and our economy running, but that are often earning too much for public assistance or to be seen in poverty metrics. But they're still not earning enough just to cover the basic costs for their families. But spreading the word is only the first step. We really need to act for Alice. And just like you do here in South Carolina, our partners are doing that. They're making a difference across the country. One united way, one country, one region, a group of regions, one state at a time. But united, it all adds up, and we have a role to play. Alice partners across the country are making a difference, for example, by consolidating and eliminating medical debt for Alice in Arkansas, or using Alice data to inform and geographically target 211 resources or VITA tax prep sites in numerous states like Pennsylvania, Georgia, Louisiana, or providing emergency assistance and filling critical gaps in childcare, housing, or other basic needs for Alice households in states like New Jersey, Maryland, Texas, or using Alice budgets to inform eligibility criteria and expand programs in many states like Virginia and Florida, or using Alice data to inform state policies and writing Alice data into legislation in states like Hawaii and Michigan. Now, these are just a few examples of that inspirational work that's going on across the network, but there's a lot more, and there's also a lot more to be done. To see some examples of the policies and practices and programs our partners are doing, visit the Alice in Action database. So that's at unitedforalice.org/alice-in-action. So we hope you can check that out. But for now, just thank you. On behalf of the National Alice team, really just a deep appreciation for all that you do in South Carolina to improve the lives of Alice households and create broader pathways for financial stability. And we can't wait to see what you do next. Thanks.
Thank you, Dr. Anglin, and thank you to everyone for joining us today to learn about the state of Alice in South Carolina. Following the webinar, our team will send out an email this afternoon with a recording of the webinar, the State of Alice Report, and links to learn more about information shared today. Please also complete the follow-up survey to get connected with your local United Way or to reach out to your local team to volunteer, donate, or support local Alice households. Thank you and have a wonderful day.